Series 8, 9 months, 3 weeks, abandoned by the system. I was hospitalized for 9 months and 3 weeks. Paralyzed down my left side. Facial droop. Slurred speech. Brain lesions. Demyelination. They called it ADEM, inflammation that stripped my nerves likewise left to rot. I had a speech therapist early on. She helped. But as the left side of my jaw weakened, my teeth began to decay. I developed severe tooth sensitivity and gum pain. My jaw couldn't close properly. My nerves were exposed. I begged to see a dentist, over and over again, for 9+ months. No one arranged it. Meanwhile, a fellow patient, no urgent issues, saw a dentist and had a tooth booked for removal within 1 week. I was never even referred. Now I'm discharged with advanced decay, exposed nerves, and not a single mention of dental pain in my DIS plan. I'm forced to rely on public waitlists, beg a GP for help, and live in daily pain. I'd been a patient at that hospital for over 7 years. They knew I had a hernia. They told me surgery couldn't happen until I lost weight. Well, I did. I lost it all during my 9.5-month admission. And still, no surgical review. No scan. No acknowledgement of my daily bowel problems, pain, or surgical need. They ignored it, just like they ignored everything else. They left me on a catheter for 9 months. I wasn't taught how to trial avoid. No education. No bladder clipping. No follow-up. Only when I pushed for it in early June did they attempt a trial avoid, but by then, I was set up to fail. They removed it once due to a skin issue, but never supported a full retrial. Now I'm home, still catheterized, still untrained. No continence nurse. No flushing kits. No education. Just me, learning how not to get infected or die. The neglect wasn't just medical. It was physical. It was environmental. It was constant. I was handed dirty water jugs multiple times, grime stuck inside, not cleaned properly. I received stain cups, especially for coffee and tea, old brown rings, never washed. Plates and mugs were often reused. No hygiene. No sterilization. I was living in a hospital, and still fighting bacteria every single day. It got to a point I had to refuse drinks. For 3 months, I said no to the tea lady, not because I didn't want comfort, but because I was afraid of infection. Even the towels they gave me told a story of inequality. I noticed I was often handed towels from the bottom drawer, towels that were older, stained, sitting unused in excess storage. They thought I didn't notice. But I did. I used to walk past the hallway. I saw the shelves. I knew which towels were fresh, and which were thrown at me as good enough. In early May, I tested my power wheelchair in the sandpit training zone. I got stuck. I wasn't injured, just curious. I called security. They helped. All good. That night, I returned to the ward around 11:30 p.m. No nurse. No welcome. No assistance. I got myself back into bed, alone. No one checked on me. It wasn't until 9 a.m. the next day that the in-charge nurse burst in to check. 10 hours later. After I'd already slept. After the story was old. That's the kind of ward this is. React when convenient. Ignore when silent. I was also burnt. One morning, they gave me hot tea, no lid, no tray, no safety. It spilled on my abdomen. I was left with a burn mark. Other patients experienced the same. One even needed a skin graft. I told the director of nursing. Loud. Clear. Immediate. Still, no change. Hot liquids kept coming, lidless. Another risk normalized. Then came the privacy breach. One day I went to the patient fridge, and found a bag marked with my full name, DOB, address, and phone number. Anyone could have taken it. They quickly removed the sticker like it would undo the violation. But the damage was done. My armband, showing my details, was also left hanging in my room, visible to everyone who walked past. I complained repeatedly. No one protected me. And behind all of this was asbestos. In early 2025, asbestos was discovered in the old hospital diner. No public alert. No protocol. Just a quiet flyer handed out. A dehumidifier quietly placed across from me. No official communication. No patient meeting. Just another silent cover-up of something life-threatening. Meanwhile, I've sent over 200 emails. 2. Hospital Patient Liaison Office. Health Ombudsman. QHRC. Human Rights. NDIS Health Minister. National law firms. Only one law firm replied, asking for info. I sent it. They ignored me for 7 weeks. Then suddenly reached out the same day I was discharged. Too late. Too strategic. Too familiar. This isn't neglect. It's design. I've been burnt, ignored, denied dental care, left on a catheter, given dirty supplies, stripped of privacy, lied to, and discharged like I didn't matter. But I did matter. I still do. And I'm telling the truth, even if no one else will. Join the movement. Help expose this system. Cheering megaphone emoji. Follow, at Justice for the Forgotten 2025 Classical Building emoji. Foundation, at IZXR Foundation on Instagram and TikTok. Present emoji. Donate or become a member to join Glow by IZXR and enter our first giveaway. Check out link with bio. This is Series 8, abandoned by the system. 9.5 months inside. 200 emails sent. 0 accountability. But I'm still here, and I'm naming everything.